Today, lawmakers are debating a bill about how much you pay when you go to the doctor. They're specifically talking about those facility fees, a fee many of you have told us caught you by surprise when you got your bills. Anusha Roy joins us from the Capitol this morning. And Anusha, this bill has already been through an evolution.
Yeah, Corey, and it has been at the center of a fierce debate and a very coordinated response from the Hospital Association and hospitals across the state. Now, a facility fee is for outpatient care at a place that is owned by a hospital. It is essentially paying for everything outside of the doctor. We are talking some nurses, technicians, cleaning services, building maintenance, and that list continues. But advocates are saying that people were really getting caught by surprise. Bills that were sometimes double or triple what they were expecting to pay. And they had no idea what a facility fee was, never had a chance to prepare for it either. At the same time, though, hospitals are saying they stand to lose billions of dollars because of a bill like this, and that would compromise and put a lot of healthcare access at risk.
If you're not reimbursed to pay the nurse who is bringing you back and doing your initial vitals, if you're not paying for that tech who is reading your scan, the list goes on, it makes it really hard to continue providing those services in Colorado.
And starting with preventive services and telehealth is a great start to ensure that while we better understand this issue, patients are taken out of the middle of these billing issues.
So the folks who do want to see this change said especially bigger hospitals have that financial wiggle room to be able to absorb some of these costs. The Hospital Association for a long time now has said, though, hospitals across Colorado are in a financial crunch, especially compared to pre-pandemic levels. So that back and forth has led to a very scaled back version of this bill that's going to be discussed today. It would prohibit these facility fees being charged to patients specifically for telehealth as well as preventative care. Corey, the one thing that all sides are agreeing on, though, is increasing the transparency so that at least people know that they're getting health care at a place where they could see a facility fee pop up on their bill.
Absolutely. So they're not surprised by these bills once they get them. So is there a sense of programs that are at risk because of this?
Yeah, so I got an email from UC Health talking about, things like a behavioral health program that's providing therapy that would be at risk because it is funded through facility fees. They said a lot of their clinics that have consolidated with UC Health would be at risk. But on the other side, we've also heard from patients who said, they were going for very critical doctor's appointments. We're talking like seeing the cardiologist, and then they got their bill, which was nearly double what they were expecting. And now they're thinking twice about going back to the doctor and can they pay for this? So, there is a lot of debate on both sides. And again, we're going to be hearing from patients and a lot of testimony. That hearing is going to be starting at 1:30 here at the Capitol.
And that's a very scary situation when people are second guessing whether or not they should go to some of these very critical appointments. All right, Anusha, thank you.